Welcome to the Medical Conditions and Procedures channel. This channel's goal is to educate, enlighten, and assist people to make informed decisions about their health. In this video, I explain cardiovascular disease. Cardiovascular disease refers to a group of conditions that affect the heart and blood vessels. It is also commonly known as heart disease. Cardiovascular disease is one of the leading causes of death worldwide and includes various conditions, such as coronary artery disease. This is the most common type of cardiovascular disease. Coronary artery disease occurs when the arteries that supply blood to the heart muscle become narrowed or blocked due to the buildup of fatty deposits called plaques. Coronary artery disease can lead to chest pain, also known as angina. Coronary artery disease can also lead to a heart attack or myocardial infarction. This happens when blood flow to a part of the heart is blocked for an extended period, causing damage or death to that part of the heart muscle. Cardiovascular disease can lead to a stroke. This occurs when there is a sudden interruption of blood flow to the brain, usually due to a blood clot or a ruptured blood vessel. A stroke can lead to brain damage and various neurological impairments. Cardiovascular disease can lead to heart failure. This condition happens when the heart becomes weak or damaged, and it cannot pump blood efficiently to meet the body's needs. Cardiovascular disease can lead to arrhythmias. These are abnormal heart rhythms that can be too fast, too slow, or irregular, affecting the heart's ability to pump blood effectively. Cardiovascular disease can lead to peripheral artery disease. This occurs when there is a narrowing of blood vessels outside the heart, usually in the legs, leading to reduced blood flow and potential pain and complications. Several risk factors contribute to the development of cardiovascular disease, including high blood pressure or hypertension, high cholesterol levels, smoking, obesity, lack of physical activity, unhealthy diet, diabetes, family history of heart disease. Preventive measures to reduce the risk of cardiovascular disease include adopting a healthy lifestyle, such as regular exercise, a balanced diet, avoiding smoking and excessive alcohol consumption, managing stress, and controlling blood pressure and cholesterol levels. If you or someone you know has concerns about cardiovascular health, it is essential to seek medical advice promptly. Early detection, management of risk factors, and appropriate medical treatment can significantly improve outcomes and reduce the impact of cardiovascular disease. I'll explain the treatment of cardiovascular disease in another video. Thanks for watching. If you would like a medical condition or procedure explained, post in the comments below. Don't forget to hit the subscribe button and turn on the notification bell, so you never miss any of our upcoming videos.